biggest South Asian media group, Y Media.
We all deserve the best healthcare, and we believe that healthcare needs to work for everyone and leave no one behind. At Trillium Health Partners, we serve the most patients of any hospital in Ontario, in one of the largest, most diverse communities in the country. We have never waited for others to define our future. We have always defined it for ourselves. When the community was changing, we changed too. 10 years ago, we combined 3 hospitals because we believed that together we could create a new kind of healthcare for a healthier community. Then, in 2020, the pandemic hit. When everybody in the community was forced to stay apart, we stood together. When they did their part and stayed home, we did ours and went to work. And we didn't stop. Vaccines arrived, and we vaccinated the first person in Peel. We didn't stop until we delivered 500,000 doses of hope. But our work isn't done until everyone has the health care they deserve. That's why we're launching Trillium HealthWorks. Trillium HealthWorks means a new Mississauga hospital, expanded Queensway Health Center, and stronger community partnerships. It will mean more beds, doctors, nurses, and allied health professionals, shorter wait times, and greater specialization closer to home. But it's about more than that. We are not leaving anyone behind. We're preparing for the healthcare challenges of tomorrow, today. We are looking beyond our walls to find new ways to meet the community's needs. Making this change happen won't be easy. It will take all of us working together with compassion, excellence, and courage. And together, we will make healthcare better for everyone.
Hello everyone, my name is Yudhir Jaswal. I'm the group editor at Y Media. Today we have a very special guest here at Channel Y Studios. We have the President and CEO of Trillium Health Partners, Karli Farrow. Karli, a very warm welcome on Y Media. How are you?
Thank you for having me. I'm great. It's a real pleasure to be here and be able to talk about our community and our healthcare system.
Thank you so much. And just for our viewers' benefit, if you'd like to tell us about Trillium Health Partners first.
Yeah, great. I would love to. So Trillium Health Partners is one of the largest academic teaching hospitals in Canada. We have over 1,500 hospital beds where we deliver acute care specialized services across the region of Peel, particularly in Mississauga and West Toronto. Our hospital sites include the Credit Valley Hospital, the Mississauga Hospital, and the Queensway Health Center. We're also part of a broader network that includes our partners that work across the healthcare system, including an organization called Partners Community Health that was started in the last couple of years that focuses on seniors care. And with Partners Community Health, we've just opened a new seniors care facility, a long-term care facility that opened to seniors earlier this year. So a lot of activity, and we deliver services across the lifespan from birth to end of life, and connected with partners in primary care, all the way to the kind of highly specialized care that delivers transplants, et cetera, at downtown Toronto.
You know what, sometimes we very often take all these great services for granted, and you just mentioned from birth till end of life. This is what I say many times on air, on radio, or on TV as well. Hospital is something, whether you're just 2 days old or you could be 100 years old, we could all need a hospital. That's the service you give. Take us through this process. How many volunteers, doctors, physicians are there at Trillium?
So it's a great question, and you know, we often say at Trillium, the heart of the community is what makes a hospital like ours actually work well. We have over 15,000 people that are a part of Trillium Health Partners, and we serve, with those 15,000 people, over 1.7 million patient visits per year for the population that we care for. So that includes over 1,400 physicians. Our physicians span all kinds of specialties from primary care. We have cardiac surgeons who are amongst the best in the world, neurosurgeons, specialists in all kinds of pediatric, specialized seniors and geriatrics care, and all the way to very, very specialized end-of-life palliative care. One of the things that makes our organization strong is that we have a very team-based approach. So we have well over 10,000 staff, including nurses, your social workers, your pharmacists, occupational health, physiotherapy, but we are all focused on working as one team. And then at Trillium, what makes it a really important patient experience is that we have volunteers, and we have a very strong volunteer program that includes over 500 volunteers and growing. Before the pandemic, we had almost 2,000 volunteers, and so we continue to grow that program coming out of the pandemic. And then importantly, we're training the next generation of healthcare professionals. So that includes every year we introduce 54 new medical students at Trillium Health Partners. They are a part of the Mississauga Academy of Medicine, which is a part of the University of Toronto. We're also affiliated now to the new Toronto Metropolitan University Medical School, which is not taking medical students yet, but working with our partners in Brampton, really, really proud to be a part of that work as well. So, you know, all 15,000 plus of us working together to serve the community, and really what makes it special is then our connectivity with a region that continues to grow and where we do see, as I said, over 1.7 million patient visits a year.
Oh, that's quite amazing.
Yeah.
I think we would need 10 CEOs to run that. But in the interest of community and so many other things in finance, we have you as a CEO.
Yeah.
Take us through what are the challenges. I want to talk more about the hospital community, so many different things here, but let's talk about you as a person. And also take us through, as we were discussing outside as well, what were the challenges during the COVID time as a CEO, and what are the challenges now? Yeah,
so great question, and thank you for asking it. You know, healthcare is a calling for those of us who are a part of it. It's a mission that you are dedicating your life to the service of others. And so much time is spent to invest in how you become a part of the healthcare system. But we face a system that has incredible constraints, and the needs of our patients and families come first and foremost, and in that we see greater demands than ever before. And we also serve a community that grew faster than the services that are needed to take care of them. So that means at our hospital, we actually have the greatest capacity demands in the entire province. We have more need for service based on how fast we've grown in the past. And when we see that population grow into the future, and the aging population, complexity, all the miracles of science that have allowed people to live longer also come with the reality of having to be able to figure out how to care for them. You know, as a leader, first and foremost, you have to focus on your why. So that mission and that purpose of actually connecting with the people in your community that need you is really what I wake up every day and think about. This was, you know, in the face of the pandemic, something that we were all challenged with. And as the COO at the time, Chief Operating Officer, and then became the CEO, we really had to face every day as leaders, how do we stay connected with our people in the face of real fear and also a true need to serve the community. Healthcare workers on the front line at the beginning of the pandemic, facing incredible and extraordinary pressures, while also facing the fear of a virus that we did not know a lot about. And what I found and learned through that process that has carried me through is that people need to know the important reality that's in front of them. You know, we cannot sugarcoat the demands of a healthcare system that were incredible during COVID, but are incredible now as well as we're coming out of COVID, because we have a growing population with incredible and complex needs, and are trying to innovate in a way that can deliver. So you have to face the reality of what is in front of you. But then the second pieces of that really are about how to have the confidence in every interaction and everything you're doing in that given day. So while we think about setting back to the really large scale challenges we actually only have today to focus on how we can contribute to making progress happen. And then really summing that up to say, how do we stay connected in that to make this experience in the face of all the challenges we may have, one that we will only grow stronger from. And I think that's the story of Trillium. You know, we merged as an organization in 2011 because we knew in this city, if we came together, 3 separate organizations had merged in the 90s to become 2 organizations. And then we said, we need to come together as one organization because together we can do more for patients and families. We can introduce medical teaching, more teaching of other healthcare professions, including our nurses, including pharmacists, social workers. We knew that we could create research and innovation at scale that could deliver new ways of doing things that the community could benefit from. So it's kind of that challenge that you face, and you have a choice. Do you face the challenge of the day and say, I'll let it weaken me? Or do you say, let me go back to my purpose. I'm here for the community and patients. And now how do we work together to actually take advantage of this moment to change things? And I think that's what we're focused on at Trillium.
Wow. And this is amazing stuff. And I also want to know regarding the new technology. Of course, we would be using automation, robotics, artificial intelligence. So how are we doing there at Trillium?
So great and important question. Let me talk about a few things. One, this was one of the silver linings from the pandemic. We really sped up the use of technology to deliver things like virtual care. Okay. So what we see now is that Trillium is advancing the use of virtual care where we can take specialists that are located in the hospital and connect them into the community so that people don't have to come to the hospital to receive that specialist care. So we're doing some of that with partnership in long-term care. I mentioned Partners Community Health and other long-term care providers. And we want to grow that, and with partnerships, see that people could avoid having to wait in an emergency department where the waits are too long, and rather access with connectivity to wherever their primary care provider is or closer to their home, or in the case of seniors who are living in long-term care, they can have access to that virtual connectivity. We can make assessments then from the hospital as to whether or not you need to come into the hospital for the kind of diagnostic tests or interventions that can only be delivered there, but avoid the situation of an ambulance having to be called, you having to be brought into an emergency department that are overcrowded, and it's not an efficient or effective way. Nobody wants to deliver healthcare that way. So virtual technology is been a game changer since COVID, and now we're figuring out with government partners, how do we actually work this into the system? The other piece of technology that we are, or an advent of digital technology is, of course, artificial intelligence. And in healthcare, AI is being talked about as an incredible transformational opportunity. But we know in healthcare also that it has to be handled with great trust. And so at Trillium, we have some phenomenal thinkers, clinicians who are thinking about the use of artificial intelligence, for example, as a partner to help you identify through diagnostic imaging with more accuracy what your disease path is. We're also using artificial intelligence to help our clinicians guide them to predict when a patient can be discharged earlier. So it acts as a partner to make the job of the clinician easier and to improve quality and overall efficiency, because that means if we can predict sooner what you need to go home, we can get you home sooner. And that's better for everyone, including the healthcare system. But at the center of everything we're doing on AI, and we have incredible researchers. We're connected with places like the Vector Institute, which is one of the founding, as a part of the University of Toronto, founding and original thinkers on AI. We're thinking about trust. Front and center is trust. Everyone has to trust us as the hospital, as doctors, nurses, clinicians, that the care that you receive is accurate and that we all feel confident in the pathway that was created. And so we're taking a very careful approach to developing how we use AI with the community. For example, we have a community partnership right now where we're working with partners outside of the hospital to understand how can we use AI to better predict what parts of the community may be more susceptible to diabetes, which will allow us to put preventative measures in place in the community. But you have to develop that with people in community. Then we're deploying it in the hospital, places like I said, in the emergency department, right up front. How do we predict when you could be discharged from the hospital? How do we help our radiologists with better diagnostic tools to diagnose disease? And then we have partnerships where after we've deployed it, we're monitoring performance. Everybody's talking about the fact that AI will come with an understanding that we don't know how it works over time because it's based off of large amounts of data. And so on the back end, we're also monitoring the performance over time. So development, deployment, and monitoring. And we think that here in Mississauga, we can be one of the leaders in healthcare AI. We have an incredible ecosystem of clinical people, of businesses in the GTA, and we have one of the most diverse populations in the world. So we're testing it with this huge diverse population in a careful way that keeps trust at the center, that's going to be good for healthcare and good for Canadian communities overall.
Wow, very interesting stuff. And I'm sure there are many challenges as a CEO, but one of the challenges is definitely the finance aspect.
Yes.
And as much as I'm sure all of viewers know that the federal budget, the provincial budget, the number one item on that is the healthcare. But we still see a lot of constraints, and I can clearly see there are a lot of challenges when you're running a healthcare system. So tell us about that, and also while you're explaining about the finance aspect, what are the challenges? Also, what are your expectations or what sort of support you would need from the community or from any other federal or provincial partners?
Great question. So, healthcare continues to take up a larger and larger portion of particularly provincial funding. And that is because we have such an important social program in the Canadian healthcare system. We like to say at Trillium, our doors never close. Our community can rely on us when they see the blue H. We are always there for you. We don't turn you away, and we are there at your most vulnerable moments, your most joyous moments, your sadness, your fear. We're there with specialized care. But that system is becoming more and more expensive. Why is it becoming more expensive? Through medical discovery, people are living longer, but they're also living with more complexity. So more interventions with equipment, pharmaceuticals, highly skilled people. This all comes at a price. So what the goal is to move upstream in the healthcare system to try to prevent disease. And so what does a hospital have to do with that? We're here for the cardiac surgeries, for the highly skilled interventions that only a hospital can do. But what we recognize at Trillium is that to make the healthcare system sustainable, we have to connect outside of our walls to say, how can we play a role in preventing disease? I'll give you an example of how we're doing this. We knew that during COVID-19, a large number of people stopped getting basic screening tests. So as the regional hospital for cancer, we've actually taken on a project with our research institute, with our community partners that are based in the community to say, how do we identify pockets of the community where screening rates are lower? And we actually match that against socioeconomic assessment as well to understand what kind of barriers may exist. If we can get to a community and we can work with community partners that know people in their neighborhood, they speak their language, they go to their places of faith or school or places where they convene as a community, they can help us understand, working with primary care, working with public health, working with our partners in the delivery of healthcare, how do we reach out and get more people screened? Because if we can get more cancer screening in place, we can prevent that onset of disease that comes later and with more complexity. So that's just one important example of how we are trying to think about going upstream. That still leaves us with a gap in healthcare services. So in the city of Mississauga, as I mentioned, we have grown faster and we have greater need than any place else in the province. And Trillium actually, with great support from the provincial government, has Canada's largest infrastructure project underway right now. So we're building not one, but 2 new hospitals, and that includes the new Gilgan Family Queensway Health Centre. Shovels in the ground right now. Will be a $350 million, 350 bed, much more than $350 million, facility of rehab and complex continuing care, specialized state-of-the-art center for that, first in Mississauga. And then this time next year, we should be shovels in the ground and building the new Peter Gilgan Mississauga Hospital. This will be one of North America's largest hospitals, right here in Mississauga. It will be a center for research, innovation, highly specialized care that includes cardiac, neurosurgery, really wrapped around innovation. It's also the home of the new Shaw Family Hospital for Women and Children. So we are really transforming the whole picture. Just as Mississauga has grown into a big and vibrant city, your healthcare system is now at that place where we're growing as well. But these are very expensive resources. They will last generations and be there for the community, and they will be a part of an interconnected system of care. But we are part of being able to build these buildings and pay for the equipment and the kind of research and technology that goes into them means local fundraising. And so that fundraising is underway now. We have amazing events like Diwali, and we will be initiating next year a campaign to try to raise money and awareness, working with our city partners. There's always a local share in a community to build this kind of healthcare infrastructure. So working with community partners, working with donors and all neighborhoods to contribute to this, in addition to the provincial government that pays anywhere between 85 and 90% of these construction projects, which are massive. And we see a ton of construction in the city of Mississauga right now. Healthcare is a part of that.
Wow. I like when you said our doors never close, you know,
Yeah.
because there are many other areas where we see, hunger,
Yes.
and food banks. We see sometimes they have to refuse, very unfortunate, but of course they have limitations and challenges, but in your case, you already said that. And finance, it's a very important part.
Yeah.
And I must say, before I move on to the next question, whether any sort of fundraising activity that we do here in Canada for any health group, but specifically since we have the Trillium CEO over here, so I would say any fundraising activity done by Trillium as well, we must support that, whether it's a Trillium Diwali Gala or any other activity that we are doing, we must support that. It's very, very important for us. Another thing which is always in question, being in media, I think if there is one area which we get a lot of calls from, and if you could shed some light on this one, we've discussed this before, that's the emergency department.
Yes.
The emergency department, they say why there is so much of wait time and there are so many questions.
Yeah.
I'll let you address that.
Yeah. This is the number one challenge that we face. And, our clinicians work so hard to deliver the kind of expert care that can only be provided in a hospital. But what we know is that we face incredible pressure because part of the feature of the Canadian healthcare system of the fact that our doors never close mean that we're often the last stop for people. This is the place that they can turn to if they've lost their family doctor, if they can't get access to care in another way, if they're suffering and are malnourished or homeless. We are the place that can take them. What we're experiencing, particularly in the city of Mississauga, but this is true across all parts of Canada, and to be honest with you, a pressure that's seen across the world, is that the front door is where you see the wait times, but a whole healthcare system works in terms of how you move through the hospital. So what often happens at Trillium Health Partners is you may come and you may need a bed to be admitted into so that we can provide that specialist care. However, we have patients already in those beds. And those patients are more often now seniors that have more than 2 complex conditions. So they're elderly, they're frail, and they have a lot of complexity where we can't send them home. And so they stay in hospital longer with us so that they can be restored to the point in time which they can go home. And then we have to work with our partners to make sure that they have supports at home or they have access to long-term care. One of the important things that we have become involved in is our work with Partners Community Health, the seniors care company that I talked to you about. We got involved in creating Partners Community Health because we could see that there wasn't enough long-term care. And though working with our partners across that sector, we saw we needed to come in and make sure that there was that kind of support. So why is that important? It's important because we know the longer someone waits in a bed in our hospital, waiting for long-term care, the more the emergency department, the person in the emergency department is waiting to get into that bed. So it is the way the whole system flows together. So the way we're thinking about it is threefold. First and foremost, we want to try to avoid you having to come to the hospital. I mentioned virtual care. This provides incredible opportunity. If we are able to partner with long-term care, with primary care, so we initiated a program, for example, where primary care providers in our city can call a number, and without having to send you to the emergency department, they can have access to a specialist in the hospital, so we can try to prevent you having to come through the emergency department. We also have partnerships with home care providers where even if you do come to the hospital, whereas in the past we might have admitted you, now we will say, we're going to send you home with extra home care supports, and you're going to come back for your diagnostic test. We want you to be cared for at home. So we try to prevent the hospitalization in the first part. Then once people are admitted, we're working on efficiency. How do we actually ensure you get the highest quality of care, but you don't have to stay longer than you want to? A great example of this is how we work with Trillium provides one of Canada's best cardiac surgical programs. And at Trillium, if you come in for cardiac surgery, you can go home sooner because of a special partnership we have where your care is seamless. From the moment you arrive for your surgery, we tell you, this is when you're going to go home. This is the home care provider that you'll have. You'll have connectivity back. That gives you the comfort to know I can go home earlier. It gives our clinicians the comfort to know we are connected to one team that is caring for that person in the community, and it reduces length of stay so we can see more people. So in our hospital, efficiency, that's an example. And then on the back end, becoming partners with the community that delivers long-term care, reimagining what that long-term care looks like. I'll give you an example. Sure. Partners Community Health that opened its doors in one of Canada's largest long-term care facilities. It has dialysis right in the building. So that's an innovation, because in the past, if you were living with chronic kidney disease and you were in long-term care, you would have to be transported out of long-term care. You are more prone to be hospitalized even though you had a long-term care bed. So how do we innovate? Well, we innovated by saying we have to create a long-term care home that feels like home. Every floor feels like a separate part of a home, but it's connected to a larger facility that has the scale to be able to deliver a dialysis center, which is in the basement of that facility. And then we will add to that virtual care, specialist care. So the goal is that those seniors never have to leave that long-term care home to get access to the hospital. Whereas today, more often, you would be sent from the long-term care home right into the emergency department. So it's really entry, let's try to avoid it. Let's try to make it most effective and efficient, and then let's partner on the back end. And we're doing some really cool stuff here in Mississauga that's actually innovating, like big innovation across Canada, because we have the greatest challenges, but with that comes a team that is focused on the greatest innovations.
That was my next thing I wanted to touch upon. Thank you so much for taking us through all this. We've talked about infrastructure, procedure, and of course we talk about the finance aspect. Now let's talk about the team. It's very important, and I'm sure you would be facing challenges as well. And during the COVID time, everyone had great respect, even now or even earlier as well, great respect as frontline workers. Two parts on this question. One is, talk us about the challenges. How are we, because we have to have a very competitive team. You're doing surgeries, it's a matter of health. So how do you as a CEO maintain a very competitive team? One part. Second is, there are foreign trained professionals coming to this country. How well are we integrating them with the healthcare system? Please.
Great questions. I love to talk about our team. First and foremost, Trillium Health Partners goes through, like all other hospitals, a process of accreditation. And coming out of the pandemic, this hospital was we actually faced the highest levels of COVID over any hospital in Ontario. Our teams already were facing incredible capacity pressures, and they were tired. And we came right out of the pandemic and said, the accreditors are coming. They're coming to test our quality. And in that accreditation, our score was 99.7%. 99.7%, that's over 2,000 specialized standards for a specialized hospital like ours. And the thing that the accreditation body, Accreditation Canada, said that I am most proud of is this organization is all about people. People has to be at the core and the culture of what you do. And for Trillium, it always has been. The way that we stay focused on that is, first and foremost, we have had to acknowledge that wellness has to be front and center, and we're not always good at it in healthcare. And particularly coming out of the pandemic, we saw more people leave than ever before because they were burned out. There's no question. We've put in place a lot of initiatives, and you can only put it in place the right initiatives if you're working with the team. So we spend a lot of time on engagement. We have councils on every unit. We have councils that work across the hospital focused on what are the things that we can do to ensure that you have the right working conditions, that you have the kind of supportive leader, that you have the right supports if you need them, like mental health support, etc. That's a continuous effort for us. Engagement, having leadership very present on that. I can't emphasize that enough, because if you're not listening to your people, you're not improving. The next piece of the puzzle is people want to grow their careers. And what we find with the new generation, so 50% of Trillium staff have less than 5 years experience in our organization. That's what our reality is coming out of the pandemic. And a ton of those are new grads. So half of those people have also worked for less than 5 years. What we find with the new generation of healthcare professional, they want to grow their career. They want to vary their career. They want to try different things. So what we can deliver at our organization is we are such a large organization working with one healthcare system. You could start your career at Trillium and you could move to multiple different units. You could become more specialized. We do internal in-house training. So if you want to become a critical care specialized nurse, you can do it at Trillium. If you want to become a leader, we have a mentorship program for leadership. So we create career pathways for people. And that's what we find people want. And then the next piece I would say is that healthcare professionals want to help change the system. And this is something that's very important to Trillium as we move forward as well. We have a research institute called the Institute for Better Health. It's one of the top 40 research institutes in the country. And we're focused on system. How do we improve the system? So we don't compete with our colleagues downtown Toronto, like Sick Kids and Toronto General Hospital, that do bench research and discovery. We're focused on how do you innovate to make a better system. And so what we are creating is an environment where people can come in, they can practice, but they can also be a part of research and innovation and teaching the next generation. And that really feeds their kind of aspiration of purpose and a higher calling that they want to do to change the world. People got into healthcare to change people's lives. How do they impact a system that they can see needs changing as well? So we think about it in a very holistic way and very centered on everybody is seen. So I'm going to move to our international graduates and our internationally trained professionals. Something that is very important to Trillium, it's in the core of our values, is the fact that we represent and serve one of the most diverse communities in the whole world. That is our strength. That is what makes this community incredible and extraordinary. And that means our people are also amongst the most diverse workforce of healthcare professionals in the world. And so we spend a lot of time thinking about how we create inclusion and equity within our team so everybody can see themselves in leadership, they can see themselves in changing healthcare, they can have a pathway and mentorship. We created, when the government opened up after COVID, new pathways and the regulatory colleges that manage how you get licensed to practice. When we saw that opening up post-COVID and we knew we had shortages, Trillium really took advantage of that to say, we actually want to be one of the leaders in taking people into our organization who have been trained elsewhere and fast track them into practice. But you know what? That can't happen if you don't actually create the conditions for people's success. And so part of our goal in creating a very specialized program, which is now award-winning, our teams have won awards on how they've created a mentorship program that's wrapped around, if you're a professional trained elsewhere, you're coming into a whole connectivity that we create for you that gives you mentorship from somebody who may have connection to the country where you've come, speaks your language, that you feel you can connect with. We have our leaders very tuned into what is your success story? How do we focus time and energy? We put new roles in to help mentor people and guide you right at the point of care. And you know, some of my proudest moments are being able to talk to some of these internationally trained individuals who talk about their experience at our hospital. And when I say, you know, how does it feel? They say, I feel welcome and I feel belonging and I feel that I can fully use my skills, but I'm also learning this healthcare system, but I'm working within a team that's supporting me in that. So that's what makes all the difference. So we want to be the center that says, if you're trained elsewhere, we want you to be able to come. This is a community that needs you. This is a community that you will see, you can find people who've come from your country, who have connection to your country, speak your language, understand how we celebrate all the different parts of our community. We have a lot of celebrations that are focused on inclusion, and that then creates the opportunity for every single one of those people, like all of our people, to realize their potential, which then has a virtuous circle of becoming a magnet for that kind of talent.
Wow.
I could talk about them all day. It's amazing.
No, I think you've covered the very good points. Wish we had more time, and we'll definitely would want to carry on the discussion and invite you to our studios. But anything else you want to add to our community before we let you go? Please do so.
Well, first of all, thank you for having me here, and why media is such an important part of our community and the connection that we have to a community. And I would just say a huge thank you. Trillium, as I described, had never closed its doors during the pandemic and never closes its doors. We've always felt that the community has our back as well during COVID and after. And people's patience and kindness as we're grappling with the kind of capacity pressure, their trust in us that we are still world leading in our specialized care. And then their commitment to us, because we're building the future of healthcare. We're building 2 new hospitals, and we're building long-term care, and we're helping our community build primary care. That takes commitment from everyone. And we are so grateful for the fundraising and the contributions that happens. Healthcare is for communities, but it's built by communities too. And we couldn't do it without you. So just a massive thank you. A thank you to you, and a thank you to our whole community for everything that you do to support Trillium Health Partners.
Very welcome. And Karli, thank you so much for your time. We look forward to having more discussion. Thank you.
Amazing. Thank you.
Thank you. Take care. I hope you enjoyed today's discussion. That's all the time that we have. Stay tuned with Y Media.
Biggest South Asian media group, Y Media.